I am very excited about this interview I'm bringing you today. I'm going to be talking with a PA who is building her own medical legal consulting business. She's going to tell us what exactly it is that she does, how she started doing this, and how you can prepare to do it. I think this is an amazing opportunity for PAs and NPs, probably one of the best that I've come across so far. The reason I like it so much is because we already have the bulk of the knowledge that we need in order to do this job. And it's very flexible on time. So it's something that you can do just as a side hustle in addition to your full time clinical job. Or if you want to drop down to part time hours, you can start doing this on the side to supplement your income. Or if you just want to get out of medicine altogether, this is a very legitimate opportunity for you to use your medical knowledge and be able to do something that's going to completely replace your income and probably even surpass your clinical income. So, if you are feeling a little crispy fried in medicine or just looking for some extra income, then definitely stay tuned. Hi, it's Michelle with the Medicine Couch. Thank you for joining me. If you like what I do and you like this channel, please help support me by hitting that subscribe button and sharing this video with colleagues and friends who might find it interesting. Now, let's get into this interview and learn all about medical legal consulting.
My name is Susan Ferrero. I'm a physician assistant. I've been a PA for almost 20 years, and I live in South Carolina currently, and I did my PA training in New York City.
Well, welcome to the channel. I'm so happy that you're here, and I'm so excited to talk about what you are doing now. But tell us a little bit about your PA path since graduation until now.
Sure. So when I graduated, I started in orthopedic surgery, and then I went to the emergency department, and I worked there pretty much for the rest of my career between emergency medicine and urgent care, with a year of urology thrown in there, and then a couple other little things like aesthetics that I dabbled in for a while.
What we're going to talk about today, which is really exciting to me, is something that you're doing that is actually non-clinical. So will you tell us a little bit about what that is?
Absolutely. So I left clinical practice at the end of last year, 2023, and I started doing medical legal consulting. So I work with attorneys and help them on their cases, personal injury and medical malpractice cases, help them understand the medical aspects of them.
Can you tell us a little bit more about what medical legal consultants do and kind of what your week looks like and what you do on a day-to-day basis?
Sure. So there are different types of medical legal consulting. And I think what most people are familiar with are testifying experts. So when there's a medical malpractice case that's brought against someone, a physician, a nurse, a PA, they need a medical expert to come in, review the case, and determine if the standard of care was met. What I do is mainly behind the scenes stuff. So I'll look at a case, if it's a medical malpractice case, I'll look at it first to see if there is merit, and that is any specialty, because as PAs we're trained in medicine, we're trained in all aspects of medicine, and we know what should be and shouldn't be done, and it's pretty easy to know if there was a breach in the standard of care. So for personal injury cases, I review the medical records, basically put together a medical summary or chronology, and help the attorneys understand what is involved in their case, what the injuries are, what the damages are, what might be going on down the road. There's a lot of education that goes along with it, because most attorneys don't have any kind of a medical background. So they're relying on someone to kind of help them better understand that and then prepare them for their cases.
So just make sure I understand. So you're basically reading through a chart, which as a medical person, we understand all the terminology and like you said, we understand like did they order the appropriate tests and stuff like that. So you're going through the chart and you're kind of summarizing in, I guess, more layman's terminology.
Exactly. There's a lot in a medical record, and there's a lot of heavy medical jargon that attorneys just don't understand or laymen don't understand. And it's similar to when you're explaining something to a patient, a diagnosis or a treatment option. You're not educating them on the level of a medical provider, because they would have no understanding of what you're talking about. So you have to be able to break that down to them so that they understand it. And that's exactly what you're doing with attorneys. And should a case go to trial, an attorney needs to be able to explain that to a jury. So you need to be able to explain it to them so they understand it on a layman's level, and that they can be able to then teach it to a jury. So there's a lot of education that goes along with it as well.
So we know medical malpractice attorneys would need like a medical consultant, but what all attorneys and kind of cases actually hire medical consultants?
Yeah, so medical malpractice, obviously, like you said, and personal injury. So that can be motor vehicle accidents, slip and falls, wrongful death, product liability, anything that involves a medical record, essentially, even a criminal case. If it
Okay.
involves some type of domestic dispute or something, some type of abuse or injury, then you can also help with that as well.
Oh, okay. So are you doing testifying or are you just behind the scenes educating the attorney?
So I'm currently just doing behind the scenes when it comes to testifying, and this varies from state to state, but most states, for the most part, you have to be clinically practicing to be a testifying
Oh,
expert in a malpractice case. Some states, if you are in a role as an academic, then that's okay. So I'm currently not doing any testifying, but I would do that if it were in the realm of what I could do based on the state. But most of what I'm doing is behind the scenes. So looking at a record initially, and if I see a medical malpractice case that looks like the standard has been breached, then I would recommend that they have an expert look at the case. So if, say, it was a cardiologist and something looked awry, and they would get a cardiologist that would then testify for that case.
sometimes there could be more than one medical expert on a case, one that's like kind of behind the scenes and one that's testifying.
Yes. So when a case comes across an attorney's desk, and we're talking malpractice, I mean, with personal injury cases as well, but with malpractice, you have to be able to prove that there was a breach in the standard of care when it came to the medical provider. So a lot of things happen in medicine. We know this. A lot of things don't go right, but it's not always malpractice. Sometimes there's just a bad outcome, and it's not anyone's fault. But people go to an attorney and they want to know if there's something that went wrong that caused their injury. So by looking at it as a PA, instead of hiring a testifying expert right off the bat to look at it, because that's expensive.
Right.
Testifying experts charge a lot of money. To have a medical provider look at it at a lower cost point is much more cost effective for them.
Okay. And so I think I interrupted you because I'd also asked you kind of to tell us then about like what your day to day or your weeks look like. Can you fill us in a little bit more about what is it is you actually do?
Sure. So day to day, it varies. I'm reviewing medical records, going through, determining what the important parts are, determining the injuries, determining if there's merit, and then putting it together in a medical summary or in a chronology so that they have something that they can refer back to. Having phone calls with attorneys to discuss cases, whether cases are something they should go forward on, discussing injuries, educating them on injuries. There's also the daily activity of running a business, sending
Yeah.
invoices and marketing and,
Yeah.
networking and all that kind of stuff that goes along with being a business owner as well.
When you're looking at these cases, like what kind of things are you looking for to pull out for the attorney?
There are four aspects that you're looking for, four elements. The first one is duty. Did the person being sued have a duty to the plaintiff? The second part is breach. There needs to be a breach of that duty. The third part is damages. Something can happen and there can be a breach in duty, but if there are no damages, at the end of the day, if nothing really happened, then there's no case there. The last part is causation. They need to be able to show that what that person did caused those damages or that harm. So
Yeah.
those are the things you're looking for when you're looking in a case. And even in a personal injury case, the same kind of thing. You're looking for, if it's an accident, somebody had a duty to be driving their car properly and they didn't. They ran a stop sign. They breached that duty and they caused damages. Somebody now has a broken leg. So some of those are pretty straightforward. Some of them are a little tricky.
I guess you have to be able to understand their injuries and understand like what kind of potential problems it might cause in the future because it's not just like what happened right now, right?
Exactly, right. So that's the benefit of being a provider and looking at it, and instead of just an attorney or their paralegal looking at it and pulling out injuries and medical diagnoses and putting them together, I'm able to look at them and say, yes, this is what this is, but this is what is potentially going to be a problem down the road. So if
Yeah.
somebody breaks their leg and they've got an interarticular fracture, then down the road, yeah, they might end up needing some type of joint replacement, or they're going to end up with arthritis potentially. And those are things that need to come up when they're figuring out damages. It's not just about the here and now, it's about what's down the road as well.
How did you get started doing this? I mean, what even made you think about doing this?
So, like I said, I was burnt out from medicine clinically, and I was ready to leave and I was ready to go and be an interior designer. I wanted out. I did not want to ever have to see another patient. I didn't want to ever have to deal with another hospital system. And I did some serious soul searching and tried to figure out what it sat down and figure out what it was that I was looking for, what I wanted, what I liked, what I didn't like, things, pros and cons
Mhm.
of different jobs. And I did consider going to law school, but I didn't want to go to
Mhm.
school for another 3 years and start all over again.
Yeah, and all
And I
that
did
debt.
exactly.
Yeah.
Yeah, I just paid off my loans.
Right.
So I was at a point where I said, I know that this is something people do. I know that there's a crossover of law and medicine, and that there are people that do this kind of thing. And I looked into it and I found a course that basically teaches the tort law for medical providers. So I took that course to see if it was something I was interested in, which it was. And I did that quite a long time ago and was thinking, oh, someday maybe I'll do it. And then I finally just ripped the band-aid off and said, if I'm going to do it, I should do it and do it now.
So you said you took a course to kind of help you understand the law aspect better. What was that course? Was it through like a university, or how did you find that?
I took a course that was online through Barbary. It was the only one I was able to find that was for medical professionals other than nurses. So it
Hmm.
was geared more toward providers like physicians and PAs.
Okay. And did you do any other kind of courses or training?
Nope, that was it. I just did a lot of research. Honestly, I did a ton of research looking online to see if there were any PAs that I could find that did this, see if
Yeah.
there were any physicians I could find that did this. And it was very few and far between that I found. And most of the, if not all of the PAs that I found that do something along this line, they do it all, it's all testifying expert stuff. They're reviewing
Yeah.
charts as testifying experts. I found one woman who does it actually in an attorney's office who's a PA, but that was it. So there was no real data to go on.
Yeah. And I think that there is a PAs in legal medicine group, Palm, I think. Did you ever talk to them?
I talked to some of the people in that group. Yes,
Yeah.
APOM is a group.
APALM, that's what it is. Okay. Yeah.
Yes, and from what I could see, they mostly focus around testifying expert
Oh, okay.
and training PAs and things how to properly document. But yeah, I'm sure some of them do a little bit on the side, but I think most of them are
The
practicing
expert
full
witness.
time and are doing expert witness.
So when you talk about this course that you took, are you learning actual law, or kind of what are they teaching? Like what kind of information do you have to know about the law in order to do this job?
Going into the course, you don't need to know anything about the law. This is not really a legal course. This is a course that teaches you a little bit about the legal system and about tort law, which is what this is. So if you have no idea what that means, that's fine. You take the course, they teach you the elements of a case. This isn't a legal course per se. This is more a course for medical professionals who want to learn a little bit about the law.
And so you're talking about that you were trying to find a course and that you only found one that was not geared towards nurses. So do a lot of nurses, and when we say nurses, I'm talking about like RNs, do a lot of them do medical legal consulting?
In looking for a program similar to this, I came across, I don't know, 500,000 programs for legal
Wow.
nurses. But this was the only one I
So
could
the answer
find
is
for.
yes.
So the answer is yes. The programs are vast for nurses in this area.
Okay.
Nurses have been doing this for decades, which is why I looked into this thinking, okay, nurses are doing it. I mean, PAs, I have a much broader education. I practice medicine. I was trained in medicine. So this is 100% something I could be doing, 100% something PAs could be doing. So yeah, nurses have been doing this for a while and have kind of built a specialty on it. And it's
Yeah.
definitely something I'd like to see PAs branching out into more.
Yeah, because I think, and not putting down RNs in any way, they have some great knowledge and some great experience under their belts. But I think that as a provider, just we look at things differently and we're trained differently. And especially I'm thinking about like understanding the long-term sequela of an injury. So I would think that providers would be valuable in this. So are there physicians that do medical legal consulting? Like are attorneys used to using people besides nurses?
Yeah, so some large firms have physicians on staff that they use for case reviews. Most of the physicians I've encountered are practicing full time and they're just doing testifying work or
No,
reviewing cases and determining merit, kind of on the side, but again, in their specialty, right? So
right,
as a PA, we're trained in everything and we, have practiced generally in so many different areas. If you look over the course of a PA's practice, most of them don't stay in the same thing. We've kind of gone to different areas. So we have that extra
right.
experience.
I do think that PAs would be excellent in this because we know more than RNs as far as looking at it from a provider's standpoint, but we wouldn't be as expensive for attorneys as a physician. So, yeah, it seems like
Right.
we're kind of like the sweet spot for this. Is that what you think?
Exactly. Exactly. We are perfectly positioned for this because we know how to treat, we know how to diagnose, and that's what we do on a regular basis. So we look at
Yeah.
a chart much differently with a much different eye than a nurse would.
When you talk to attorneys, because I imagine you have to kind of go out there and drum up business and network and talk to attorneys, do they know what PAs are, or are you having to actually educate them about our role?
Great question. Because I was concerned about that when I started. I thought, all right, I've got to go in there and explain, first of all, what a PA is and what they do.
Right.
But these guys have been working with medical records for eons. They work on malpractice cases, they work on personal injury cases. They've looked at these records and they know exactly what we do. They know that we practice medicine, they know that we treat, and they're very familiar with that. And I've actually had really good feedback from the attorneys that I've met with. Initially, they say, oh, yeah. Oh my gosh, I didn't even think about a PA doing this. This would be great.
I imagine one of the hard things about starting this kind of business is like actually finding the attorneys to work with. So, how do you go about doing that? Is it just a bunch of cold calling?
Right. So with any business, it's the hardest part is trying to get started and to find clients. So yeah, I cold call. I started with going to local offices, going out to attorneys, personal injury malpractice attorneys in my area and calling on them, leaving information. There's a lot of follow-up that goes along with it to get your foot in the door and get somebody to answer you. So yeah, there's a lot of networking that goes into it. Anything that you can do to get yourself in front of attorneys so that you can talk about what it is that you do.
Okay, so you're building this as a business and you've left clinical medicine. I don't want to pry into your finances, but I know people watching this might be curious. Is this something that PAs can make enough money in to totally replace their clinical income?
Yes, I think that it is definitely something that once you get going and you've got a good business going, you could replace your PA income without a doubt.
And obviously, it's not going to happen right away. Like any business, you have to go through the building phase, right?
Sure.
So, if you're doing this from the consultant standpoint, like building your own business, how do you bill for this? Is it like hourly when you work on stuff, or is it by project?
I bill hourly. Some people bill a flat rate for a project. If I'm looking for a testifying expert, if I'm finding a testifying expert for someone, then that's just a flat fee.
Yes, I imagine that figuring out the billing, like what you're going to charge, is also difficult. What were you seeing out there that kind of helped you figure out what to bill? Like, was there some range you've seen out there, or anything you've come across?
In doing research, I came across mostly testifying experts, and testifying experts are charging anywhere from $350 to $500 an hour for their services. So, as a behind the scenes person, not being a testifying expert, I bill a little bit under that.
I asked you earlier if this was something that PAs could possibly replace their clinical income with. But I'm wondering, and I know you're early in your business, but do you anticipate that this is potentially something that could even exceed clinical income for PAs?
Absolutely. Absolutely. I've met quite a few nurses that have built some pretty good businesses and they're charging less, slightly less than what a PA would be charging. And they have built businesses and have subcontractors where they hire other nurses to do work under them. So yeah, there is definitely an opportunity for PAs to build a business and grow a business and make more than what they've been making clinically.
Yeah, that's exciting. I think that this is a great opportunity. And when you say subcontract, I guess that maybe if you come across something that's in a real subspecialty that you don't have familiarity with, then you can subcontract that out to another PA who has expertise in that field, or even if you get more work than you can handle. Is that what you anticipate for subcontractors?
Exactly. Exactly. Something that is right out of your wheelhouse or comfort zone, or something that you just maybe don't know enough about and you don't have the time to research. Or like a NICU case, it's much easier to give to a NICU PA than to try to go through that. And yeah, over time, if I get busy enough, that may be what I look for is people to do the same kind of work I'm doing in the same cases I'm doing, but subcontract out to them so that I can have more of an income.
Yeah, that makes sense too, because I imagine there would be lots of PAs that would like to subcontract because they don't necessarily want to leave clinical practice or go on their own and do the hard work of building the business, but they would like to
Right.
do this kind of work on the side. So yeah, that's pretty exciting. I'm excited for you. I think this is a great opportunity.
I'm excited too. It's hard work. It's hard work. And that's definitely something I tell people when they ask me. I've had some PAs reach out to me and ask me about it. And I just set the standard of, it's hard work. It's hard to start a
Yeah,
business. I'm sure I don't have to tell you, you're constantly working. You're not working medically, but
yeah.
you're constantly hustling.
But what's interesting about that, right, is that even though you're constantly working and probably working more hours than you were clinically, there's a whole different feel to it. There's that burnout, at least for me, just kind of lifted because I don't think any of us are afraid of working hard. It's just all the other beat down things that come with working in medicine, right? And this,
Exactly. It's different when you're working hard to build something for yourself than when you're working
Mhm.
hard to build something for a company that doesn't appreciate
Right.
you.
So, what are some of the things that you really love about what you're doing now, or maybe something that even surprised you about what you're doing?
What I love the most is that I'm still able to use my medicine mind in just a different way. It's like solving a puzzle sometimes, and I'm a big puzzler. So, and I don't just mean jigsaw puzzles, but I mean like, crossword puzzles and word puzzles and things. And I like to try to solve
Right.
things. And this, a lot of it is sorting through things and putting together the pieces of it and coming up with the story of what happened, and then being able to explain that to somebody who has no idea and explain it in a way that they're like, okay, so that they can then go on and help someone. So I'm able to continue helping people, which is what, I mean, we all went into medicine for, right? But just in a different way.
So, what are some of the things that have been more challenging, maybe than you expected in starting this business?
Well, there's a learning curve, like with switching specialties, as a PA, and we are able to switch specialties. And when we switch, you always feel like a baby giraffe trying to get your legs underneath you, and that's the same kind of thing. Is I still feel like that baby giraffe trying to
Yeah.
to navigate this new area, but it's exciting, which it always is, right? You start in a new
Yeah.
specialty and you're excited. And so it's exciting, but it's also a learning curve. So it can be exhausting. And there's always the business side of it. We as PAs do not have to go and get our own patients. We go to the
Right.
hospital, you show up at the office, somebody's made the schedule for you, you see what's on the schedule, and then you go home. You are not out on
Yeah.
the street corner with that big cardboard arrow trying to get people to come into the building.
Right.
So this is a completely different scenario. You are essentially out there trying to get clients, and it's constant work, and there's a lot of no's and there's a lot of radio silence, and you
Yeah.
have to have a thick skin to be able to do this.
Have you been doing this long enough to be able to get like repeat customers? Are you having some attorneys that you did work for come back to you?
Yeah, so I've started having some repeat clients, and I've started to get clients who are telling other attorneys that they
Oh,
use
nice.
me. So that's been really good. That's what you want. That's the
Right.
best way to do it is to get referrals so that people are then, then you're doing less of the work if someone else is doing your marketing for you.
Yeah. So, I mean, imagine you'll always have to be networking and looking for clients, but I guess I can see that eventually you should get to a point where you have this network of attorneys that know what you do and have used you before. And when they have cases come along, then they reach out to you. So I imagine that part will get a little bit smoother.
Definitely. As you start to, like in any business, right? Know, like, trust, as they start to get to know you and like you and trust you, they see the work product that you are able to give, then yeah, then
Yeah.
they're gonna come back.
So people looking to that might be interested in this, like what kind of personality traits and or skills, like what kind of people do well in this kind of work, do you think?
You need to be analytical, which most people in medicine are. You also
Yeah.
need to be detail oriented but concise. So you need to be able to take, voluminous records and be able to boil them down to a concise, straightforward product that is
Mm.
easily understood. You can't be putting every single thing that's in the record in the chronology or the summary, and they don't need to know when someone got a Tylenol for their pain and all that. You
Right.
need to be able to figure out what is important and what's not important. And
Right.
what's not important is just as important as what is important, because you don't need all of that extraneous stuff. I would say PAs have been going through records. That's what we do on a daily basis. So we understand what is important and what isn't important.
It made me think of like combing through the records when you're going to present to a physician. It's like doing that, but then when you present, like you're presenting it in layman's terms instead of using the medical terminology, right? I mean, so
Yes.
you figure out what's important to tell them.
Yes, no, that's a good analogy because, right, you have a patient in the ER and then you're admitting them and the hospitalist wants to know a little bit about the patient, but you kind of have to know everything because they might ask you, well, what was this potassium?
Right.
The attorney's not going to ask you what the potassium was, but you have to know what is important to tell them, because the last thing they want is you dribbling on the phone about what's not important. They've got things to
Right.
do. So, and you also need to be able to effectively communicate that, like you said, in layman's terms. So you have to be able to effectively communicate complex medical information to somebody who has no medical background.
So when we talk about people that would be, good moving from clinical practice into medical legal work, I wonder about experience. How much does that come into play? Like, could a new grad or somebody that has very little experience, could you see them moving into this?
So theoretically, I mean, you have the medical education. However, I wouldn't suggest it, because as PAs, we learned so much in practice, even in the
Yeah.
first year, that I would say you want to have that experience under your belt. You want to know how to navigate an EMR. You want to know how things work in the hospital system. Those are things that come up in these cases, and those are things that you're going to want to know, as well as the experience of different medical treatment that you come across.
Because there's the book knowledge, right? But then there's things like how things actually work in a hospital, especially it's complicated, and that's kind of a harder thing to get a feel for, and you do have to do that through experience, right? And I can see how that could come into play in like a malpractice case. You have to really kind of have that experience to understand if the provider was doing things as one would in a hospital or clinic setting, I suppose.
Yeah, you need to be able to speak to, does this feel and does this reflect what a provider would do, what a PA would do? And if you haven't actually practiced, then you don't
Yeah.
really have that experience.
Right, right, yeah. So we've been talking about PAs a lot, and then of course RNs who have been doing this, but we haven't really talked about NPs, nurse practitioners. Have you seen any nurse practitioners doing this, or do you think this is something that practitioners could do as well?
Yes, I have come across quite a few nurse practitioners that are doing this. And as nurse practitioners, they have an advantage over an RN because they do have that provider eye.
So people are watching this and they're like, I really think I would be good at this. And we talked on resources a little bit, but could you summarize kind of what you think are resources out there that people could maybe turn to and look into?
Yes. So the course that I took through Barbary is an MPLC course. So it's the Medical Professional Legal Consultant course. And you get a certification. I think it was a 12-week long course. but it teaches you a lot about law. So that's something, if you're something you're interested in, that's something that I would look into. There's also SEAK, which is SEAK. That has to do with testifying experts. So if you're interested in doing testifying expert work, I would look at SEAK's website. And you can always check out my website, which is medlawpa.com. And you can always, my contact information is there, so you can reach out to me if you have any questions. I'm happy to always help.
So I'll put all of those links down below for people just to give you some help. As we talked about, this is kind of new frontier. So don't expect like a ton of information. You're going to have to put things together yourself. All right. So is there anything else that you want to say? Any other information that you want to give people or thoughts about PAs or NPs becoming medical legal consultants?
I would say if this is something you're interested in doing, definitely look into it. We have the knowledge, you have the knowledge as a PA, as an NP. It's something that you can do, and it's something that can help you escape a burnout situation. Even if you do something like this on the side and you work clinically part-time and you do this part-time, you don't have to necessarily leave clinical practice full-time. But if you wanted to, you
Yeah.
could, and you could build a business around this.
It just dawned on me too that people could build this as part-time side work, just to bring in extra income right now, and then you're building that base. So in years down the road, if you want to make it a full-time opportunity, then you've already got that base built. So yeah, I get excited when I hear about opportunities like this because I can just see this being right for so many PAs and NPs out there. So thank you so much, Susan, for sharing all of this information with us and telling us about what you're doing. And I wish you all the best of luck in continuing to build your business.
Thank you so much for having me, Michelle. This was fun.
Now, I do think medical legal consulting is an amazing opportunity, but it's not right for everyone. So, if you are still looking for non clinical roles that you can move into, then check out this playlist here of all the interviews I've done with PAs and NPs who have moved into non clinical roles. Thank you so much for joining me. And as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.